Welcome to UVB Home Phototherapy. Phototherapy, or light therapy, is the use of light to treat skin conditions and is commonly used to treat psoriasis, dermatitis, vitiligo, and other skin disorders. It involves UV light, a kind of light present in sunlight to reduce skin cell growth and inflammation. Sunlight contains UVA and UVB rays, but the beneficial effect for your skin condition is attributed primarily to UVB light. Treating your skin with home UVB phototherapy can be an economical and convenient choice. Like phototherapy in a healthcare provider's office or clinic, it requires a regular treatment schedule. For many patients, phototherapy involves multiple treatment sessions a week. Although the individual sessions might last just a few minutes, commuting to and from a doctor's office multiple times a week can be a time-consuming and exhausting experience. The main benefit of home phototherapy is convenience. Being able to do phototherapy at home is very convenient. Home phototherapy units come in multiple shapes and sizes to accommodate the different levels of body surface that need to be treated. Once a healthcare provider prescribes you a home phototherapy unit, the device is then shipped to your home. The unit is pre-assembled but requires you to unbox and set up the unit prior to calling your pharmacist for specific instructions on how to start. For 7 series, it is heavy and weighs about 75 pounds, and so you may need another person to help. Minimal assembly is required to screw the feet and grates onto the machine. If you have any questions about assembling the unit, please reach out to Davlin. Please watch another Davlin instructional video for how to technically work the unit. Place your unit in an area where others, including people and pets, can leave when the light therapy is in progress. To avoid burning yourself, please do not start your home phototherapy unit on your own without any instructions from your provider. If you have not heard from Davlin within 2 weeks after your unit is ordered, contact Davlin to check on the status of the order. The effects of light treatment are not immediate, and the length of time necessary for maximum benefit differs from patient to patient, and the reason for treatment. It can take at least 8 to 12 weeks before there is any noticeable effect. Sometimes it can be sooner. Do not get discouraged. The most important thing is to be consistent with your treatments and to follow your doctor's treatment plan. Follow the treatment times as per instruction provided by your dermatologist and pharmacist. Note that if you were doing clinic phototherapy, your home unit will most likely have a different power output than the unit in your doctor's office. Therefore, the treatment time will probably be different as well. Be consistent with the areas of skin you are treating with the light. Light treatment is usually done 3 times per week with a minimum of 24 hours between sessions. Some patients may need to use pre-treatment application of mineral oil. If you are instructed to use mineral oil, you need to be consistent. Make sure to double-check with your dermatologist or pharmacist before using. Always protect your eyes with UV goggles that are included in the box. It's usually best to cover the area of skin you are not treating with clothing or sunscreen. The most important thing about covering healthy skin is to be consistent, and always use the same covering techniques on each treatment. If the face is not involved, use a towel or cloth to cover your face in addition to the goggles provided. If the face is involved, sunscreen should be applied generously to the facial areas that don't require treatment, including your ears, and use lip balm with sunscreen. For men as appropriate, also cover your genital area. If you are placing your hands or feet directly on the surface, you may also cover them with a towel while you are being treated to minimize the amount of unnecessary UV exposure. Do not use any other topical medications or moisturizers prior to the light treatment in order to decrease the risk of burning. It is also important for you to ensure that all other persons are not around during the treatment session to avoid unnecessary exposure to the UV device. Occasional or temporary redness may be normal if it resolves within 24 hours. If your redness is sustained, ask your doctor if you should reduce your treatment times. Moisturizer should be immediately applied following treatment to prevent excessive dryness and subsequent itching. Maintain regular follow-up appointments with your dermatologist. These appointments are required to monitor response to phototherapy, adjust dose appropriately, and monitor for any suspicious skin lesions. Short-term side effects of phototherapy include redness, dryness accompanied by itching, and occasional blistering as a rare side effect. Long-term side effects include photoaging and a theoretical risk of skin cancer, although studies have shown no association with increased skin cancer risk and NB-UVB therapy. Let your pharmacist or dermatologist know of new photosensitizing medications that you may be taking, as your phototherapy may need to be reduced. If you're unsure if your medication is photosensitizing, contact the pharmacist, as this could be a medication not related to your skin condition. Let your pharmacist or dermatologist know if you have lupus, melanoma, sensitivity to light, or history of radiation treatment. Please follow up with your dermatologist about 3 to 4 months after starting home phototherapy and at least yearly afterwards. Please keep a log of your treatments, and please bring the log to your doctor appointments. Follow up with your dermatologist earlier if you are developing new spots or worsening condition. Please contact your provider if your skin clears up, as you may possibly be able to take a break from therapy or decrease frequency of treatments. If in the future you have to restart phototherapy, be sure to contact your pharmacist for restart instructions. Your unit comes pre-programmed with FlexRx counts. Be sure to contact your pharmacist when you're down to 5 to 10 treatments remaining for a refill code. Contact Davalin Tech Support at 1-800-322-8546 if any operational issues or problems arise. Someone is available to help you Monday through Friday. By accepting the delivery of your prescribed home phototherapy unit, you indicate that you understand, accept, and agree to the following. I will follow up with my doctor while actively using my home phototherapy unit, will notify my doctor of any changes in my medications, and will have a full-body skin examination at least once per year. I will only use my home phototherapy unit to treat my skin condition, and I will not allow anyone else to use my home phototherapy unit. I will use eye protection every time I use the unit, and I will follow other special instructions, such as covering my face or genital areas as directed. I will call my doctor right away if I develop a sunburn, redness, worsening of my psoriasis or other condition, changes in skin lesions such as moles or any other problem that might relate to my therapy. I will log my treatment times and results and provide them periodically to my doctor. Phototherapy or light therapy is typically prescribed by a dermatologist. Phototherapy involves exposing the skin to ultraviolet light on a regular basis and under medical supervision. The key to success with light therapy is consistency. If you have any questions about how to program your device to deliver the doses your doctor provides, please contact Davalin Service. Please also check out the other video links that have been provided to you, such as how to set up the unit, enter your code, and refill your unit. Now that you have watched this video, please contact your pharmacist for your specific treatment time to get started. Congratulations with your new home phototherapy unit.